Hello everyone. Today's topic is one of the most intense and fascinating subjects in trauma medicine: gunshot wounds. We're going to find out what really happens inside the human body when a bullet enters it, how doctors actually remove it, and the shocking science behind survival. Before we begin, don't forget to hit the like button and subscribe. It really helps this video reach more people who might learn something new. First, let's understand something important. The severity of a gunshot injury depends on three main factors: the type of bullet, the distance it was fired from, and where it hits the body. Let's start with the first one, the type of bullet. There are countless types and calibers of ammunition, but we can simplify them into three main categories. The first type is the standard bullet. It enters the body and usually stays lodged inside. The second type is far more dangerous. It enters the body and then explodes, scattering fragments through the tissues. These are often used in wars, and civilians rarely encounter them. The third type is known as shotgun pellets, a spread of tiny metal balls fired together. They tend to cause surface-level injuries and are generally less lethal than the other two. Now the second factor, distance. The farther the shooter is, the less power and penetration the bullet has when it reaches the body. But the third factor is the most critical: the location of the wound. We can divide the body into three main regions. The head, the deadliest place to be hit. Once a bullet penetrates the skull, there's almost no resistance, and it can destroy brain tissue instantly. The chest and abdomen come next. Here, a bullet has to pierce multiple layers: skin, fat, muscle, and might shatter ribs, puncture a lung, or even strike the heart. In severe cases, it can pass completely through the body. And finally, the limbs, the arms and legs. Getting shot here offers the highest chance of survival because there are no vital organs, just muscles, bones, and blood vessels. If you ever come across someone with a gunshot wound, remember, the biggest danger is bleeding. Stopping the bleeding quickly is often what saves a life. Now let's answer a question that surprises many people. What does it actually feel like to get shot? Movies make it look dramatic, people screaming in pain. But in reality, it's very different. When a bullet hits, the destruction of the sensory nerves is so fast that the brain often doesn't register the pain immediately. Some victims even keep walking or running until they see blood, and that's when shock sets in. Their body goes into panic, blood pressure drops, and they lose consciousness, either from fear or blood loss. Finally, how do doctors remove the bullet? If it's a shotgun pellet, it's often close to the surface and can be removed easily, sometimes even with a magnetic tool, without major surgery. If it's a standard bullet lodged just under the skin, the surgeon will numb the area with a local anesthetic and carefully remove it with surgical tools. But if the bullet has traveled deep inside, damaging organs or blood vessels, then it becomes a major operation. The real challenge isn't removing the bullet itself, it's repairing the destruction it caused: broken bones, torn arteries, damaged tissue. And if a vital organ is hit, like the heart, lungs, or liver, sadly, survival is rare. And that brings us to the end of today's video. If you learned something new, make sure to like, subscribe, and turn on notifications so you never miss our next video. Thanks for watching, and stay safe, everyone.